Welcome to the Gerontological Society of America's Momentum Discussion, where we explore groundbreaking topics in the field of aging.
Welcome to this GSA Momentum Discussions Podcast episode titled Trends in Comprehensive Obesity Care for Women as They Age. We're grateful to Novo Nordisk and Haleon for their support of the GSA Care Toolkit for the Management of Obesity in Older Adults in this podcast episode. My name is Jen Pettis, and I'm the Director of Strategic Alliances at GSA, and I'm pleased to serve as the host for today's Momentum discussion. Today's conversation focuses on the chronic disease of obesity. Obesity in and of itself has broad health implications, but when paired with age-related changes and other conditions, it adds layers of complexity, especially for women. I'm delighted to have the opportunity to have a discussion today with Dr. Anna Pendrey. Dr. Pendrey is an assistant professor at Indiana University School of Medicine and a distinguished family medicine doctor and geriatrician whose dedication to the health and well-being of older adults has made her a respected figure in the medical community. With her experience, Dr. Pendrey's commitment to geriatric care is reflected in her compassionate approach and her advocacy for improved healthcare services for older adults. Dr. Pendrey, welcome.
Thank you, Jen. Thank you to GSA and all the sponsors for the opportunity for me to be here. And it's always a pleasure to talk about something that I really and deeply care about, this topic about obesity, and especially obesity in women. And it's important to understand how there's shifts in body compositions in women as we age, and what are the changes in metabolism that can happen as we are aging.
So what are some of those changes, Dr. Pendrey, in body composition and metabolism? What really happens as women age with obesity?
So as we age, we can have loss of muscle mass, decreased bone density, and also changes in metabolism that make weight management more challenging. And why this happens is because as we are aging, and especially women after they go through menopause, their levels of estrogen decline, and there's a redistribution of fat from a gynoid to an android pattern, which means that our fat goes from our hips and thighs, goes directly to our abdomen around all our organs, and this increases our metabolic risk. Also, as we are aging, our lean mass muscle decreases, and this is very important because we lose muscle mass, but also as we're seeing how fast obesity treatments and anti-obesity medications, including mimetics, are like the fastest growing treatment options for obesity, and we can see how this also can affect, and we are going to touch base on this later on, but it is important to know that as we're aging in women after our estrogen decline, we also have loss of lean muscle mass. And why this happens? Because there's a reduction in our basal metabolic rate. And it is much harder for us to lose weight, but then it is harder for us to preserve muscle. And also, we have to have bone health. So we have to ensure good bone health because we have to have adequate calcium, vitamin D, and we have to have weight-bearing activities because as we are aging also, our bone mass decreases, and we also have changes with as we age, with especially us in women, the appetite regulation changes, and also our energy expenditure changes too. So we have hormonal shifts, we have increased insulin resistance, we have increase in hormones like ghrelin that they regulate our appetite, and they affect our hunger and our satiety.
So as a clinician, what are some key assessment principles that you consider when you're assessing older or aging women with obesity?
Basically, every woman that comes to a clinic, and if they have chronic conditions, and if they have the chronic and complex condition of obesity, we have to tailor their interventions according to every patient. So first of all, we have to realize what is happening, like what chronic conditions this patient has, if they have cardiometabolic diseases, especially heart disease, type 2 diabetes, and other conditions associated that could be lipidemias. And basically, we base on that, but also we base our interventions on functionality. So if they are independent in their activities of daily living, if they are independent in their activities of daily living as well. So IADLs and ADLs, what is their functionality? What is their support? What are social determinants of health that can influence the treatment and interventions in this patient? We need to see what their diet is, if they are active or not active, if they exercise or not exercise. And also, we have to go beyond all what is a BMI when we look to a patient with obesity, because we have to also see and analyze what medications this patient is taking that can influence them to gain weight. And we have to see what interprofessional approach and what interventions we're going to deliver to this patient.
And how do you set their goals of care? You and I have had some discussions in the past about the 4Ms. So tell me about how you start those conversations around that.
Jen, that is a very important question and the happiest question, because basically we start what is the most important to the patient. What is the most important? And they tell us and it's almost always their health, their functionality, their independence, and their quality of life. So we start there, what matters the most. And then we also use the framework about fermentation. If they have depression, they have anxiety, if they have another condition that impacts their mood, what is their cognition as well? What is their functionality? Then we also check their medications, their mobility, because it's important to check their mobility, functionality, and also their multi-complexity, because some of our patients have many chronic conditions, and obesity has many chronic conditions associated to it. And we need to also check their list of medications too.
And you mentioned earlier interprofessional intervention. So why is that interprofessional approach so important in managing obesity for women as they age?
Important question, because definitely, as we have said, obesity is a complex chronic disease that requires multiple interventions. We need the help of a nutritionist to help us understand the nutrition of our patient, what food they can acquire that can provide this patient the protein that we need for them to preserve their muscle mass. We need to make sure that this patient has the adequate calcium and vitamin D intake. So we need the help of the nutritionist. We need the help of physical therapy, occupational therapy, because we need to maintain the functionality and independence in the patients. They have many chronic conditions. Some of our patients have limited functionality, limited mobility. So it is very important to see what exercises, without hurting the patient, they can do in a safe manner and how we can help them. So these are key persons that can help us do that. We also need other professions, pharmacists, because the pharmacists, they help us, one, check the medicines that can cause and predispose our patients to obesity, but also they can help us deprescribe in a safely manner. And also they can help us the tricks on getting access for our patients to anti-obesity medications as well.
So often we see clinical guidelines and really obesity research in general that are based on younger people. And so what are key adjustments that interdisciplinary team needs to make those really adapt those current guidelines to make them more appropriate for women as we age or older women?
Definitely the studies and the support for women and the investigations, research should focus on women as they age. And this is something that we are lacking. Also, there should be guidelines, because we know there are guidelines. We know research also includes older adults. Some of them will be women, but it has to be exclusively to women as they are aging, women after menopause, women when they are entering menopause, when they're in the menopause time, and then what happens when they are in menopause and what happens as they what things are happening to that woman as they are aging. How is their functionality? How is their mobility? How is their mood? What support they have in society? There's many things that approaches that can be done for a woman to feel safe and to have health and have health in a safe manner. Because sometimes you see how women, we are susceptible from the society sometimes just to say, oh, you eat too much. Oh, you're so fat. Oh, you don't do exercise and many things. I've seen superwomen taking care of their home, of their parents, their kids, working, and then they have so much stressful lives. So how do we ease that on these patients? How we can help them?
So help them take care of themselves while they're taking care of everybody else.
Exactly.
Yeah.
What matters the most, and sometimes we forget that we are the patient is the most important part, the most important person.
We've talked a lot about things are moving fast in the obesity space. So I'd like to wrap up our discussion here with talking about what's on the horizon. So what are your thoughts about what's on the horizon for obesity care for aging women? What upcoming innovations, resources, or therapies are you most excited about in obesity care? And how can those improve quality of life and overall wellness for us all as we age?
So definitely, I feel the horizon seems very promising. And it is a horizon where I can see the potential, where more research can be done in older adults and in women as they are aging. With this fast growing treatment for obesity, incretin mimetics, it's fast, it's growing, it's developing, but we need more research to understand what happens when we provide this treatment to women, to older adults. What is their muscle mass loss? What is their bone loss? What is their functionality? How do we help them preserve muscle? How do we help them preserve bone? And what matters the most to them is their health, but their health with functionality, mobility, and quality of life. Trying to see also how we can help our patients, our women, empower among themselves, doing group activities, doing social activities, because we need to preserve our brain health as well. So I can see that in the horizon is promising, and I can see how women can empower each other. And I can see also, Jen, through the Gerontological Society of America, how these toolkits, the care toolkit for obesity and for care of cognitive impairment, it gives us a good pathway, a good framework on how to treat obesity in a comprehensive, patient-centered manner, and how we can tailor that also to treat obesity in women as they are aging, how we can provide good tips about good nutrition, good tips about good exercise, and what things to expect when you are given an anti-obesity medication, the rate and the safety of losing weight fast, and how we preserve muscle, bone, and our functionality, mobility, and quality of life.
This has been a lovely discussion, Dr. Pendrey. It's always a joy to spend time with you. You have such a passion and commitment for improving care for older adults. And we're so pleased to have you among our GSA membership and the great work you've done with implementing the care toolkits out there in Indiana. So that's just terrific. Thank you so much for joining me today.
Thank you, Jen, for the opportunity, and to GSA also for the opportunity for me to participate here.
My pleasure.
Thank you.
Check out GSA Enrich at geron.org/enrich for engaging learning resources, including toolkits, publications, webinars, podcasts, and more.